Well, I guess it's afternoon. It's past noon. So good afternoon, everybody, and thanks for coming. And those of you who have joined us online, thank you for tuning in, which will no doubt be an incredibly powerful discussion. I just can't help but start out by acknowledging that the last few weeks have provided a very vivid and brutal reminder that protecting human rights is fundamental to our mission of building a healthier world. And it's clear that we have a ways to go. Here at the School of Public Health, we are fortunate to have the Center for Public Health and Human Rights established, as you know, many of you know, it was established in 2004 with the aim of elevating the important relationship between advancing human rights and public health. Under the guidance of our interim director, Len Rubenstein, the center's faculty and staff serve as global leaders in designing public health programs consistent with human rights, challenging policies and practices that undermine human rights, and addressing the health consequences of violations to those rights. Today, our center faculty and distinguished guests will be tackling the increasingly challenging issue of the health and rights of transgender people. Over the past year, we have seen hatred and discrimination against transgender people gaining more and more traction. In many US states, legislators are pursuing discriminatory legislation that targets transgender people. According to the Trans Legislation Tracker, there have been nearly 600 anti-trans bills proposed across our country just in the year 2023. The discourse around these bills is often hateful, and many have the intention of limiting access to needed health care. As of yesterday, 85 of these bills have passed. These laws inflict tremendous harms on transgender people, their families, and their communities, and they undermine public health. Already, trans people in the US face barriers and discrimination on everything from housing to job security to legal gender recognition. They must navigate a world that is not designed for their needs and is often hostile to their very existence. Today's forum provides a chance for all of us to better understand what is at stake and, very importantly, how we can press forward with solutions. It is also a chance to honor the 75th anniversary of the Universal Declaration of Human Rights. This declaration was adopted by the UN General Assembly in December of 1948, and ever since it has served as a guide to the universal dignity, rights, and benefits of all human beings. This includes access to education, employment, fair pay, voting rights, healthcare, and freedom from discrimination and exclusion. Very importantly, the Declaration recognizes that equality, freedom, and justice are key to a thriving society and peace and security in the world. Since that declaration was adopted, there has been significant progress and rights have been realized for many, but for others, including the transgender community, there are fundamental human rights that remain out of reach. Now, as dire as this situation may feel and can feel at times, public health gives us hope and many reasons to feel that hope. Across the Bloomberg School, we have faculty, staff, and students working to advance the health and rights of transgender people. And I'm so grateful to all of you who are fighting for that change and look forward to hearing more ideas from our panelists today. Andrea Wirtz, a core member of the center's faculty, will be leading today's discussion. And we are thrilled to be joined today by three very distinguished guests. They include Carter Brown, Sarah Reisner, and Tori Cooper. You'll hear more about them in just a few minutes, but for now, let me just say thank you for coming, and we're really looking forward to benefiting from all of your knowledge, experience, and insights. In public health, it goes without saying that we stand for science, for evidence, for respect, and for dignity. I want to thank all of you for being here today, and I encourage you all to continue to stand up, speak out, and do all we can to support the health and human rights of transgender people everywhere. And with that, I am just thrilled to be able to turn it over to Dr. Wirtz, who will talk more about these issues and, very importantly, introduce our special guests. Andrea?
Wonderful. Well, thank you all for joining us today, and thanks to everyone who's joining online. I know that everyone's very busy, and so the fact that you're here today with us really speaks very highly to your priorities and all of the work that you're doing. I want to begin just to contextualize a little bit about the topics for today's session and provide a little bit more information before we start on our question and answer. So as Dean McKenzie mentioned, December 10th marks the 75th anniversary of the Universal Declaration of Human Rights. And this was really a document that was born from the atrocities of World War II and was really a collective global desire to advance society through the recognition and the protection of all dignity and human rights. So an inherent recognition of the dignity of every single human in the world. For those who aren't familiar with the Declaration, it presents 30 articles, and I could not find a good way to display it here, so you'll just have to go to the website if you've never read it. And I encourage you to do that because it's so, I think in a time when there's just a lot of atrocity, a lot of human rights deprivation in the world, it's so nice to read that document and know that 75 years ago, people from so many different countries came together and uniformly recognized the inherent dignity of all humans and set forth an agreement to recognize all of these inherent rights. And that's a really a guiding compass now that we use and when we talk about human rights. So I think we're all familiar with the term human rights, but may not have read this particular document. And this has set forth a lot of other human rights laws and documents that have since followed in the 75 years. There are 30 articles within this document, and as Dean McKenzie mentioned, they set forth the right to education, the right to a standard of living, protection from discrimination, freedom from slavery, the right to vote, etc. A number of rights that we sometimes often take for granted in our own lives. And these rights are what we consider universal. They apply to everyone, and they're aspirational, and the recognition that no setting is perfect, that there is not a setting in which everyone's human rights have yet been realized. And so we're always striving to reach full realization of those rights. And we also live in a changing world. So we have to adapt and continue to reinterpret how these human rights apply in our changing environment. Notably, the UN Commissioner has for several years now really reaffirmed that while transgender, gender diverse people and LGBTQ people are not explicitly named in the document, that it inherently covers them as well. And I think that's really important to keep in mind today. For those who work in public health and don't really think about themselves as a human rights advocate, I think that many of you probably are in the work that you do. So when we look at the right to education, the right to a standard of living, the right to vote, et cetera, freedom from discrimination, in public health, we often think about those as social and structural determinants of health, right? You need to have access to those rights to be able to have your fullest health, your fullest potential in life and your highest attainable standard of health. We also articulate in the Universal Declaration of Human Rights, they also articulate the right to health. And that idea isn't to say that everyone should have access to the highest technology and the greatest medical advances, but that in each country, recognizing that there are different resources, everyone should have the access to the highest attainable standard of care and evidence-based care. And so that's something that I think is also important as we talk through some of the laws and policies that have been proposed over the last year. So in the last 75 years, as Dean McKenzie mentioned, there have been incredible advances in human rights. And there have also been contexts in which there have been regressions of rights and some progress and then retraction. And I think that's certainly true in the United States. So in the US, some of you may know this, some of you it might be new that you're learning this, there's actually no federal non-discrimination law that protects transgender, gender diverse people or other LGBTQ people from discrimination. So that leaves it to the states to either create new laws or policies or to reinterpret their existing laws and policies to protect those populations. And so what you get is really a patchwork of laws and policies across the United States. The map that you can see behind me is produced by the Movement Advancement Project, and they are really an organization that tracks all of the laws and policies in each state that relate to discrimination or non-discrimination of different populations. This is the one that they've produced that relates to discrimination on the basis of gender identity. And so here in this case, they track laws that relate to discrimination, to matters of relationship and parental rights, non-discrimination, religious exemptions, youth, healthcare, criminal justice, and identity documents. And this map is really a quantification of the protective laws. So you can see here the yellow being, or orange being, the lowest number of protective laws, and then increasing to the green, the dark green, which represents the highest number of protective laws. And then also discriminatory laws, so those represented by states in red. And I've been sort of watching these maps over the last few years, and I noticed that there are several states that now have turned dark green, Maryland being one that's turned dark green on this map in the last year, and other states that have turned redder. So we have like kind of polar opposites and even neighboring states, as you can see. And what's important to keep in mind is that these laws aren't necessarily new. They've been coming up over the last several years, but they have certainly increased in the last 2 or 3 years. So this is another figure by the Trans Legislation Tracker, and they started tracking the proposed bills across the US, both state bills and federal bills. And so you can see in 2015, I believe there were 19 that were proposed in 2015. And now within 2023, there have been 583 bills that have been proposed at the state level. There's also 36, I believe, that have been proposed this year at the federal level. And so these bills, again, attack basic fundamental rights to education, to living one's fullest life and dignity, to access to healthcare, parental rights, et cetera. And so over the course of the year, there have been 85 now that have passed. Some of those are listed here at the bottom, and several others that are still proposed, a couple of those highlighted on the top here. When we talk about the right to the highest attainable standard of care, that's critical for ensuring that everyone can live long and healthy lives. And I think that's where it really hits very strongly in looking at the proposed bills over the last year. So 178 bills have been proposed as well that strictly tried to aim to restrict access to gender-affirming care. And for those who aren't familiar with gender-affirming care, and we'll talk about it a little bit more in detail later, but this is really an evidence-based healthcare. They're critical medical health services. All of the major professional medical associations in the US have endorsed gender-affirming care and support it, and yet we see all of these proposed bills that come out and directly try to restrict them. So I just wanted to give that background, and I'll close with a quote from Eleanor Roosevelt, who was the chair of the Human Rights Commission that was tasked with drafting the Universal Declaration of Human Rights. And I want to really take that time then to talk about the people who are doing this in all of their work and their lives, and really trying to advance health and human rights for trans people and many other populations as well. And so I'll start closest to me with Mr. Carter Brown, who is the co-founder and executive director of the National Black Transgender Advocacy Coalition, the first national Black trans-led nonprofit organization in the US. Mr. Brown's prominent leadership has established BTAC's community organizing and programming to be indispensable in the movement toward equality. Mr. Brown is a co-author of the US Trans Survey, the largest trans survey in the US, that vividly captures the economic, health, and social disparities of nearly 28,000 transgender respondents worldwide. And I think far exceeded that this year, but we're not supposed to say anything yet. His most recent accomplishments include testifying before the US Congress in support of the Equality Act, which is an amendment to the Civil Rights Act of 1964 to include protections for transgender people. I also want to add that he is this week also receiving an award from the National Center for Transgender Equality that is really an honor and recognition of so much work that he's done to advance health and human rights. Next is Ms. Tori Cooper, who is Human Rights Campaign's Director for Community Engagement for the Transgender Justice Initiative and a health and equity consultant. She's a member of the US President's Advisory Council on HIV and AIDS. She earned a bachelor's degree in human services and a master in public health. She's founder and executive director of Advocates for Better Care Atlanta, which provides capacity assistance, curriculum development, and multidisciplinary trainings for large and small organizations. She's a certified national trainer and subject matter expert with the CDC and serves as a public health advisor. Over the last 30 years, Ms. Cooper has built a reputation for excellence as it pertains to increasing visibility, access, and opportunities for Black people, people living with HIV, and transgender communities. And our last speaker is Dr. Sari Reisner on the far end of the table. He is a health inequities researcher that specializes in transgender and gender diverse health with a focus on HIV prevention and mental health. He's the director of the Transgender and Gender Diverse, did I miss that? He is, the director of Transgender and Gender Diverse Health Research at Brigham and Women's Hospital and the Fenway Institute at Fenway Health. He's assistant professor at Harvard Medical School and assistant professor in epidemiology at Harvard T.H. Chan School of Public Health. Dare we say there's a Harvard person in the room? Dr. Reisner is an investigator on multiple funded transgender health studies, has contributed to more than 300 peer-reviewed articles, and has been profiled in the Lancet as a transgender health leader. He's a board member of the World Professional Association for Transgender Health and a co-author of the WPATH Standards of Care version 8. So I hope you'll join me in welcoming them today. This is a great lineup of speakers that we have. I'm going to take my seat and ask some questions. Before I start, I do want to note, in case I forget, that lunch has moved to W4030 because there's been so much interest in joining everyone for lunch. So that's a good thing, but make sure you go to the right space. So I'm going to go ahead and start with a couple of questions. And when we talk about human rights and health, we often think about the right, as I mentioned, to the highest attainable standard of care, which includes gender-affirming care. So before we talk about the legislation, I just want to ask if someone can give a quick overview for those in the room of what is gender-affirming care, what does it mean to people, why is it important to the health of transgender and gender diverse people?
Yeah, I'm happy to start. Thank you. Mic on. Happy to start. Gender affirming healthcare refers to a variety of different things. So firstly, when we think about gender affirmation, it is a key determinant of health for transgender people. Typically, when we talk about affirmation, we talk about medical domains. So this could be things like hormones, surgeries for the people who would want to access them, pubertal blockers for young people. We can talk about psychological gender affirmation, a person being affirmed in who they feel themselves to be, and also factors like internalized stigma. We can talk about legal affirmation. So this is legal rights, right to name change, right to legal recognition of one's gender. And these together, social affirmation is the last piece, which is names, pronouns, doing gender in the world with other people. And so these dimensions are the key sort of constructs and building blocks, I would say, of transgender health. When we're talking about care specifically, gender affirming care, it's care that both is specific for trans people, such as, for example, hormones or surgeries for people who want them, but also care that is gender affirming, right? So a person is receiving services, for example, with primary care who's transgender, has a right to have gender affirming care. So that is affirmed in names, affirmed in pronouns, and so forth. So, I think often there is a focus on medical dimensions, but it really is multidimensional. And so care is broader for transgender people than just simply the actual medical care that's transition specific. So I think that's an important piece when we're thinking about delivery.
So I wrote down 3 words when thinking about gender affirming care, and those were adaptable, affirming, and appropriate. I wrote down adaptable because, as Dr. Reisner just mentioned, adaptable means that it works for, there could be a multitude of different things, modalities, that folks will receive the type of care that they need. If you are youth, that doesn't mean that you will be on some type of hormonal therapy or that you will have surgery. Sometimes it simply means referring to children, referring to youth with their desired pronouns. That's gender affirming care. It could mean access to mental health and other physical interventions that could, again, will affirm who these children are. And that's also for adults as well. And I wrote down appropriate because I'll be the baddie in the room. Often, what we're hearing is folks who don't know trans people, who do not have trans children in their circles, who do not have trans children in their families, who are telling you and us as the parents of trans kids that they know more about your child than you do. And so the word appropriate came to mind because if any of us has a child who needs some type of health care, who needs some type of affirmation, then what we're going to do is make sure that the child has everything that they need. And so gender affirming care is also appropriate for parents, for parental figures, for community members to ensure that youth get them, and then to ensure that there's access, yet another A word, for anyone who seeks to have some type of gender affirming care, whatever that could include.
I'll add also that gender affirming care is evidence based. There is research to support gender affirming care. Let's talk about, for example, medical interventions in the case of both children, young people, and adults. Really that there is longitudinal data that suggests the positive impacts, improvements in mental health, including rates of suicidality, which are extraordinarily high in trans communities, but which show improvements over time. There's rates of increased body satisfaction, psychosocial functioning, also in retention in care. So there's better rates of retention in care over time for folks who are receiving gender affirming hormones. There's also, in the case of people living with HIV, better rates of viral suppression and engagement in care. So it really is across multiple domains. There's also evidence for legal documents that match a person's self-identification, that concordant documents are associated with better mental health, depression, anxiety, somatization. So there really is a good evidence base. Can you hear me okay? Yeah, okay. So there really is a very good evidence-based. The World Professional Association for Transgender Health Standards of Care version 8 came out last fall. You can see the reviews of the research that are happening there. So when we're talking about some of the issues that come up around sort of misinformation or disinformation, it's important that we say this is an evidence-based field of medicine. Transgender medicine is an evidence-based field of medicine, and not something that's sort of in its historicity has been pathologized, right, stigmatized, but not that, but has become a field of study. So, yeah.
Well, thank you for kind of setting the stage about that. So as we mentioned, there have been about 178 bills that really focus on limiting access then to gender affirming care. So I wonder if any of you can just speak to the nuances of some of these bills. They're really quite diverse in how they're written. But if you know of examples from your own work and experiences of how those bills can affect transgender people, how have they impacted people in the community so far?
Yeah, I'd be happy to chime in on that question. These anti-trans bills are pretty much targeted to restrict access for trans people to function in society along with everyone else. We're talking about bathroom bills, religious freedom bills, and restrictions from youth protection is what they call it. And then also just restrictions from being able to access to gender affirming care. And of course, this has a highly negative impact on trans individuals' mental health, as well as their physical health. And, there's a story that popped in mind when you brought this question forward. It was, I have a friend or a colleague, she's an ally. She's a white, cisgender, heterosexual parent of a trans kid, huge ally. And so her child is now 12 years old. And this was recently, I'm from Texas, so it's very restrictive for trans individuals there. And she took her daughter to finally get hormone therapy because they banned it for a while in Texas, and then she was able to get it. And this was the happiest moment of that kid's life. But she had to tell her, don't tell anybody. because of fear that she may be arrested. They may take the child from the home. And, this is, again, this is ostracization of trans people, and especially our trans youth who are most vulnerable, who have limited rights in anything. And then they're stripping their parents of their rights by saying they have to have a certain level of consent and so forth and so on how they can care for their children. And so, these laws only exacerbate the disparities that are already there, and they continue to perpetuate the stigma and the discrimination that's already out there. So when we're talking about a small fraction of society, the trans and gender diverse, non-binary community, these are huge bills with aggressive attacks on such a small population. And so we have to realize that the bias here is definitely beyond just a political fiasco. This is really people's lives are under attack. Children's lives are under attack. Co-workers' lives are under attack, and our family members' lives are under attack. So that is my take on the nuances of these bills, and I'm happy to open it for anyone else.
So I'll engage the audience very briefly if I can. Yes.
Could you speak directly to the microphone? I'm so sorry. I'm getting texts from people online who can't hear. So
Me.
speak into the gooseneck.
Gotcha.
Thank you. So if you're white, cisgender, heterosexual, and male, please raise your hand. Wonderful. There's one person who raised their hand here. I want to make it clear to everyone that's in the room, the same people that are creating book bans, that are limiting reproductive rights, that are placing bans on gender-affirming care, even for adults who are able to make decisions for themselves, that are restricting voting rights and access all across the country, and folks who are creating these incredibly dystopian anti-immigration policies. All of this is about control. And the goal is that all of us in the room, there was one person who raised their hand, that all of us in the room can only live and function in society as in the way that benefits mostly white, cisgender, heterosexual men who are also landowners. That takes us back to, does anyone understand what I just said? I think that's absolutely amazing. And this room is a great example of why we must all fight together. Audre Lorde talks about the fact that you don't have to beat me in order for us to fight together. I think that's incredibly powerful because if you're not a transgender person, you may not always understand why backroom bills, how they impact your life. But if you happen to be a woman who's particularly tall, or a man who's particularly short, or someone who has a deeper voice than normal, or who has a lighter voice than normal, or you walk a certain way, then you also could be victimized by some of these really archaic and discriminatory policies. All right, so I want us to make sure why it is that we fight, why we're here together, and why these bills, all of these different bills, access to insurance for folks who might be gainfully employed, who pay an insurance premium just like you do. I'm so incredibly proud of the fact that TILDEF, in public health, we have acronyms for everything. And TILDEF, I think, is the Transgender Legal Defense Fund. Just last week, they were able to celebrate because they fought the state of Georgia, Brian Kemp and his administration, for insurance providers being able to discriminate specifically against transgender and non-binary folks and not having to cover health care. Can you imagine your provider saying, though you paid premiums on time, the same as everyone else, that we're not going to cover? And so think about how all of those things impact your life. Think about your own intersectional identities and how anti-trans policies in fact, do impact the lives of people who happen to not be trans also.
We've been working on a project that's NIH funded UA1 grant that's health transformative health disparities project. It's to design and test a multi-level intervention for transgender and gender diverse youth and their families by impacting and providing sort of training support, resource for providers, youth themselves, and caregivers. And when the sort of policies really began, the tides began to shift. This was starting in 2021. We were actually doing qualitative interviewing at the time, largely with folks who were in the South in the U.S. And it was quite a time to be doing these interviews, and the stories and the fear. I think you all have already spoken about this, but the sort of impact on the narratives that we received, the impact on providers who were afraid of criminalization, of losing their licenses by providing the care, also not knowing sort of what was okay, right? Not knowing what legal recourses there were for them. So that information, trans youth being worried that care would be taken away. And then caregivers, of course, worrying that not only would care be taken away for their youth, but also that they would face criminal charges, because that is also a thing that parents can face and caregivers can face in this current legislative environment. So it's important to note also, as you were saying, Tori, that the legislation is not just for trans people. Like, it's not just impacting trans people. It's impacting providers. It's impacting families. It's impacting the systems in which the care provision that we need is operating.
That's a great point. Thank you. And I think you raise an excellent point of the fact that even if bills are introduced and not passed, the fact that those bills are even brought forward and all of the really hateful rhetoric that comes around it probably, I would imagine, has a significant impact on the mental health of people, their ability to kind of live freely in society, and does cause a lot of confusion for providers. Do you have, Sari, I guess I'm going to go to you specifically, in terms of the research, can you speak to some of the research that has looked at the impact of some of these harmful laws?
Yeah, so I'll take this the other direction and say, how about health promotive effects of positive laws? Let's talk about that. So there was a paper, Dr. Tamar Goldenberg who, at UNC looked at in the U.S. National Trans Survey data in 2015 using the MAP data that Dr. Wirtz showed us with the Movement Advancement Project, looked at that and looked at the protective effects. And basically, for those states where the access policies to care were better, the health of, this is more than 27,000 transgender and gender diverse adults, they had lower rates of healthcare avoidance in the past 12 months. So, really seeing that sort of structural level patterning. There's work, I'm excited because we're all here together. I haven't seen some of these folks in person, and it's been so fun. We've been working on projects together, one of which is an NIH-funded light study that Dr. Andrea, I'm going to call you that from now on. How about that? You can get ready on all of our conference calls. Dr. Wirtz and I have been working on it, and we've all been working on it together. And so we have Wes King, who's at University of Michigan, is currently working on his dissertation. And he looked at access and equality policies. And what he found basically was that better safe rated health, this is a group of transgender women. I also wanted to say that Dr. Erin Cooney and Meg Stevenson and others are in the audience who've also worked on that. Sorry, just like it takes a lot of people to do these kinds of things. So it's a cohort of transgender women and trans feminine people in the eastern and southern US. So it's more than 1,500 people that we've been able to follow for anywhere between 2 and 4 years. So this particular study looked at protective policies and found better self-rated health, right, in areas where people were living with better protective policies, both access and equity policies. But the thing about this was that there was a moderation by race. So the policies were protective for white transgender women, and they were not protective for transgender women of color. So this is important because these are policies that were really based, the policies that Wes is looking at were based in transgender specific policies, but without looking at the broader policy context, right, there's differential effects. If we don't look at racism or policies that have, racial inequity like impact, then we also are missing something too. So I think that's just another angle, and we were talking about intersectionality to bring in here. that there's heterogeneity in the effects of these policies. And so that's really, an important finding, I think, from this. So yeah, but on average, in the studies that we've seen, we do see more promotive health policies are associated with better health for transgender, gender diverse people.
Anybody want to add to that? Well, maybe we can go off of our questions and continue the discussion about intersectionality, though, because I think that's an important discussion. And I know, Tori, you had brought up some important issues earlier today. Do you want to take the lead on talking a bit more about that? And Carter?
Sure. And one of the ways I like to think about it, have folks think about intersectionality, is all the different ways that you would describe yourself using commas. So I happen to be a Black, woman, who happens to be trans, and I live in the South, and I'm college educated, and I could go on and on. My grandparents are West Indian, and also Southern, Do you see what I'm saying? And each of us has a bunch of different intersectional identities. Those intersectional identities put us at greater risk for discrimination. The further you are from this fake archetype of being white, heterosexual, cisgender, landowning, married, Christian, the more problems you're going to have in society. And so all of those different commas make a difference. And so add to that transgender and how misogyny is a thing. And add to that you happen to be a transgender person of color, or in my case, a Black transgender woman. And there's this term that we use, misogynoir, which is misogyny specifically for Black women, and then trans misogynoir. So you might be cool with the fact that I'm a Black woman, but you hate trans people. And so I'm still at risk for further discrimination and marginalization, and that applies to folks of all different kinds. We have so many different international conflicts going on right now in the world. There's folks who have very specific beliefs about the Gaza conflict and immigration. And so depending on your intersectional identities, all of those things impact your life. And again, add to that being trans, and that there's some folks who couldn't give a crap about your cultural background, just the fact that you're trans. And so you don't deserve the right to access to life and liberty and good health and education and home ownership and employment, for heaven's sakes, simply because of the fact that you're trans.
Yeah, absolutely. I fully agree with everything that Tori said, and I will add that, when we're talking about the intersectionalities of race and gender, you have to consider class. And so specifically for Black trans people, because of the onset discrimination and biases of all the other intersectionalities, that leaves nearly 60% of Black trans people living below the poverty line, meaning that they're making less than $10,000 a year. So even the affordability to access healthcare isn't there based on just trying to navigate and live in your intersecting identities as a trans person. As Tori said, you're just adding on layers to the negative outcome, or I won't say the negative outcome, but the perceived negative treatment that is put towards transgender people, and especially Black trans people. And so that's why for our organization, living as a Black trans person, my very own experiences are what compelled me to want to be an advocate, first for myself, and then for other people who look like me, who maybe didn't recognize that their rights were being violated, or that they did have the right to do something that they were once denied. And so, the basics, employment, housing, healthcare, these are all disparities for Black trans people to attain on a basic level. Many of us in this room are college educated or college attending, employed, and we have, dreams or even current successes of home ownership, transportation of my own, knowing what I'm going to eat tonight. And simply because of these intersecting identities that a lot of Black trans people have, those basic things are a day-to-day hustle and struggle just to get. And so, that's what we're talking about is the big picture, not just the direct health access or direct, um, advocating for these bills. We're talking about human lives and life-saving healthcare and life-saving advocacy for legislation that's going to give people access to society and to be able to integrate into society with full opportunities as everyone else.
Thanks, Carter. So thinking about all of these laws and policies, we've talked about some protective laws and positive laws and others that are harmful. I think it's important to step back and also recognize all of the work that the community has done, and really that they've been at the forefront of addressing health disparities, lack of access to the fulfillment of the community's rights. And if we can just take a moment, I'd love to hear more about what your organizations are doing. And if you can talk about that in terms of advancement of health and human rights of trans people and other organizations that come to mind, really the work that they're doing to share with the audience. That'd be great. Do you want to start, Carter?
Sure. Well, the Black Trans Advocacy Coalition, again, we are the first national nonprofit organization that is led by Black trans people and centers the lives of Black trans people. We do we have a very multifaceted approach to our advocacy work. Primarily, what we do is policy and advocacy reform, meaning that we support legislation and policies that are going to fight for the equity of trans people. We also have health and wellness programs that span from everything to mentorship and community support to support the mental health of our trans people. And then we also have the physical health where we provide them, or we have collaborations with other trans-led organizations that can help provide them with free gender-affirming care for those who cannot afford it. And then we obviously also do things like this, education and awareness by speaking engagements and educating people who are on the side of equity for everyone and advocating for our rights in all spaces. And when I say advocating for our rights in all spaces, that also includes just creating safe spaces, right? Now, I transitioned over 20 years ago, and the landscape was very, very different. And then to find a safe space meant I found at least a group of 5 people, 3 or 5 people that are like me, and I can go here and actually say I'm trans out loud. Or I can go here and actually ask questions about access and resources for trans-related things. But nowadays, the definition of safe spaces has dramatically changed and expanded, right? Safe spaces aren't just a physical thing anymore. You can find safe space on the internet due to advances in technology. They have safe spaces in the workplace, safe spaces in the schools. But also, a lot of people find a safe space in another person. Before I found community, there was one person that I could trust or talk to, and they weren't even trans. But they made me feel like it was okay to talk to them about what I was going through, to, try to be a sounding board at least, or help me talk through, or help me find the resources that I need, that I felt would get me out of my depression or my anxiety because my gender wasn't aligning. And so, those are things that I would encourage a lot of us to, that's something that can easily be done. Just being a safe space for someone. And so I would just wanted to pass that on to encourage you all. When there's an opportunity to do so, please do, because again, that is a life-saving act of care simply by being a safe space for someone trans or non-binary or gender diverse.
Wonderful. So I'm one of the national directors at the Human Rights Campaign, and my program is the Transgender Justice Initiative. We operate under 4 pillars, and those are capacity building assistance, economic opportunities, strategic communication, and public safety. And one of our big priorities at the Human Rights Campaign is to ensure passage of the Equality Act. And I hope folks in the room, if you've not heard of it, that you will do your research. because that's what researchers do, that you will Google it on your work computers and on your personal computers, and that you will vote in favor of the Equality Act once it comes up for vote. Because what it does is it ensures the first legislation that ensures complete and comprehensive policy and acceptance across the board for transgender, non-binary folks, and in turn for everyone. I want to make that abundantly clear. Also, I really would like to address something very briefly that was brought into this space earlier, and that is misinformation and disinformation. At HRC, we're very intent. We're not a direct service organization, but what we do is we provide a lot of education in a lot of different spaces. And so misinformation, I like to say, is when you make a mistake. To get to the nearest 7-Eleven, you go down 3 blocks and make a left. Oops, it's actually a right. That's misinformation. Disinformation is willful intent to deceive. That's the way I think of it. And the opposition is using disinformation to confuse folks who don't know trans people, who don't know folks who are immigrated to this country from other places, who don't know people who need abortion as a form of health care. And so they're using disinformation about who folks are and who folks aren't in order to pass this legislation. And so at the Human Rights Campaign, we are determined to provide as much education and resources so that every person can make the healthiest decisions for themselves in a bunch of different areas, and so that we can help people to make better decisions for our country.
So the research and the way that I've been doing the work that I'm doing is really grounded in academic and community partnerships. So this is something that I like to call a participatory population perspective. The work that I've done, in partnership with Fenway Health, which is a community health center in the Boston area. We serve about 5,000 transgender patients a year, last calendar year, and have a research policy and advocacy arm. And so a lot of the work is research that is informing clinical care directly, as well as informing sort of trainings, evidence-based training. So for example, we have the Advancing Excellence conference coming up. That's a Harvard Medical School and Fenway Health partnership. It's actually this weekend. We have 600 providers registered for a 3-day kind of crash course training. The experts is the 10th year we've been doing it. So, really trying to make change in the sort of academic space of the School of Public Health, having sound training programs. When I got my doctoral degree, there was nobody had done anything related to transgender health, and my doctoral work was on sort of measuring trans status for population surveys. So, continuing to support trainees, continuing to support that. Other pieces are, I think when we're grounded in communities, it becomes clear what the needs are. So an example is, we did in Massachusetts, we did Project Voice, which was a survey that came out of a partnership with the Massachusetts Transgender Political Coalition. It was when there was not there was discrimination in public accommodations settings, which is public accommodations is anywhere open to the public. It's pretty vague, but it includes healthcare. So we did this study to try to push and leverage data, and actually, was part of what was utilized in the process to get that law, passed. So we do have non-discrimination protections right now in the state. So that's like an example of strategic science, I think, so that's sort of, I think, the piece of thinking, how do we do this more strategically? Not just the science, but like the translation. We were talking about this earlier about how to like translate that science and get it to the right stakeholders and people. So lastly, I want to highlight, the work that's being done in partnerships with, for example, the National Transgender Center for Equality, which is the 2022 U.S. Transgender Survey, which was fielded last year, and I know a number of us have been involved in that. Which we don't know how many people there, but it's like maybe 3 times what it would have been the last round, something like that, just off the cuff. So, but really exciting, right? Because, it's data that are up to date, we're going to be, they're being worked on right now, cleaned and so forth, but like really the ability to get a snapshot. They're cross-sectional, but still provides a very powerful snapshot that really allows for advocacy efforts. In terms of public health efforts, I think that the suicide prevalence, suicide attempt prevalence in that 2015 sample was, 41%. of a sample of 27,000, transgender people and gender diverse people. So, continuing to document this burden, there's a need to have, not just surveillance efforts, but these within community surveys with large samples that really allow us to understand the unique needs of populations, for example, immigrant communities and others that are not sort of given enough voice. So lots to do, that's for sure.
Thank you. And I think that's a good segue into the last question. I do want to mention that we do have 2 microphones. So if there are audience members who are interested in asking a question of the panel, please feel free to come up to the mic or we can pass them around. But my last question for all of you is, given that our audience here is largely public health practitioners, clinicians, researchers, et cetera, what guidance do you have for us in terms of how we can use the tools of public health and human rights too in medicine to really advance the rights and health of transgender and gender diverse people?
So I'll start so I can move out of the way. I would say increase diversity, which I'm sure many of us have heard before. Understanding that diversity isn't just Black and white. It's not just brown folks and white folks and brown and Black folks, but it also means increasing diversity of researchers from a cultural perspective as well, where they may be from. There should be folks who are engaged in research for whom English wasn't their first language. Could be a multitude of different languages, all of those different life experiences, all of those intersectional identities. And then to work closely with community-based organizations, to work closely with perhaps predominantly Black, historically Black colleges and universities, and even historically Hispanic colleges and universities. There are a number of them in California where folks who are also doing research, but research in pockets, very siloed research, can come together with folks at Johns Hopkins and create more diverse data sets, create more diverse research projects, and help the folks who are at community level to diversify the ways in which they use research.
I definitely agree with that, Tori. Just taking the intersectional approach to research, looking at all layers of a person's identity and where they are currently, and then how did they get there? Their background and their experiences are also a part of our, all the things that I have experienced have made me who I am today, not just because I'm a Black trans man, father, husband. I'm also from the South. I grew up poor, part of to a single parent. All of these things have an influence on my access and my knowledge, and just as a trans person, it pretty much gives me tools for my journey based on those things. So having an intersectional approach. Also, Tori mentioned just cultivating cultural competency. Even though we or some of us may be educated about trans identity, taking the opportunity to educate others at every opportunity is definitely going to expand the awareness and reduce the stigma around transgender identity overall. And then often for non-trans people to communicate or advocate for trans people, it's received better because they sort of speak the same language, as in, I didn't understand either, and I educated myself in this way, and now I want to share this with you. Could be as simple as that. And then I also think just advocating for legislation that promotes equality for everyone is definitely going to, because even though we change the laws, it takes us as citizens to really implement and enforce those laws. And so really being an advocate for the legislation that protects trans people is something that we can do collectively as researchers and as advocates. And then also just community outreach. Dr. Reisner and Dr. Wirtz have been phenomenal in just becoming really partners to the community and real allies to the community, and not just, I'm a researcher looking for your information, but they actually implement themselves into community and know what's going on with the community. What is the current legislation? How does the community feel about that? What are they saying? How is that affecting them? You know, if there's trans joy, they know about that too. Hey, congratulations on celebrating this. Oh, I heard this is going on. And that makes us feel as community members that they are true allies and care about the research that they're doing because they want it to ultimately come back to us in a positive way versus just I'm completing my job and I want to get this research done and the accolades associated with that. So really becoming a part of, not so much a part of community, but being in part to the community and the outreach that's given there.
Yeah, these are both of which you said. I'm like, yes, yes, and yes. Public health has a unique role to play in this, and, particularly, we're often talking about interventions that occur at multiple levels, right? Then we're talking about structural determinants and structural interventions, interpersonal, individual components. Sort of in the more short term, we need to create change at the policy level, and, it's possible with this environment that we are going to see sort of health inequities exacerbated, sort of in the short term. So, really a need to attend to that in the immediate term, like with communities is really important. Coalition building. So, public health is multidisciplinary for sure. For example, medicine and epi and other fields, but also in terms of multi-sector partnerships, education, justice, and so forth. I mean, I don't need to tell this audience that, but just a reminder of, sometimes I ask myself, like, who am I not reaching? What key stakeholders are in my sort of like worldview here that I'm not reaching out to or that could be potential partners? There's like methods, people love methods here, I hear. That's what you tell me. But there's all sorts of methods like, anthropology mapping in terms of like key stakeholder mapping. There's all sorts of things. Speaking of which, the need to really measure exposures at the structural level. Like, what is cissexism, cisgenderism? How do we measure those? We're using policies and some of the research that I talked about as, sort of a blunt stroke. But like, what are the actual exposures that people are being, what are they actually being exposed to within those contexts and legal environments? I said strategic science, but I just want to say it again because, the objectivity of science is, well, it's not so objective after all, which doesn't to mean we don't hypothesis test and work with data. We do. The questions that we ask, though, however, are anything but objective. So making sure that we're using our resources and asking questions that are relevant for public health, relevant for interventions, and then relevant for policy to be able to enact that change. Lastly, you mentioned disinformation. I just want to return to that because I feel like it's so important right now. Like, we really need to keep the peer review process, like, be accountable to the peer review process. A lot of the disinformation is happening. People are not, they're doing science that's not being reviewed, right? It's just being put right. It put, whatever quotation marks those are. But it's not being reviewed, right? It's not being held to these standards. And so as a result, there are there's a lot of information that is just completely inaccurate. So we really need to, do our studies, do them well, communicate where there are weaknesses. Every project has a weakness, every single study, but also really balance that and leverage that strength. And, I'd like to see sort of more guidelines for peer review process in this current state. And I think Hopkins is a leader in a lot of fronts. And I mean, much to my chagrin, I'm just kidding. But really could, really can make an impact, right? And coming out and having events like this really, and the dean speaking and opening it, it really does send a message, a very important message. That there's no real single issue struggle, as you mentioned, right? So anyway, lots to do. Happy to talk about it over lunch for those who are joining us.
So we'll open up for any last questions, unless folks are really hungry and want to get going to lunch. But any questions in the audience before we go? Go ahead.
Hi, I'm Martha De La Paz. I'm an MPH student here at Hopkins, and I'm also an LGBT health advocate from the Philippines. I wanted to ask regarding the equality bill because I think we have the same situation in the Philippines. 2 decades has already passed, and we haven't also passed an equality bill. So I wanted to ask, can you share some of the critical strategies organizations are doing that you think are effectively increasing support for the bill that we international students can apply in each of our own countries?
Well, thank you. So the Equality Act, again, is the most comprehensive legislation ever proposed. And what it will do is provide safety, it will provide legal recognition, anti-discrimination. It puts it on the books for every person. And it particularly impacts, and I want to make that clear, for every person. It certainly impacts LGBTQIA plus individuals even more so. What can folks do? Some of the strategies that we're using is we're actually, there are a number of different things. We have a pledge to protect Black trans lives, which is something that has been proposed and is legislation, bills that have been signed by mayors across the country, including in Atlanta, Georgia. We have to make sure to get here in Baltimore soon. But all across the country, so that at the grassroots level, at the community level, what they're doing is preparing folks, if you will, to so that if and when the equality bill comes up for vote, that their policymakers will have to vote in favor of it. And I also want to speak specifically about gerrymandering. All right, when you brought that up, it's a word that comes to mind because for many of us, it was like an AP vocabulary word. But because of gerrymandering, and every time, most people believe that LGBTQ and trans people in particular, that our rights should be protected. Most people believe that. That's what all of the studies say. Either they have no opinion or they simply ensure that we're on the right path. But gerrymandering plays such a big part in why legislation like the Equality Act isn't passed. We're not being able to vote on it because where we live, our zip codes, the communities that we live in, every 10 years, when certain folks are in office, what they do is they create additional barriers for us to vote on legislation that protects us. And so we have to ensure, whoever you are, wherever you are in the country and wherever you are in the world, that you are taking part in the political systems at the local and national level so that you can fight very hard against all of the, I almost cursed, all of the foolishness that's going on. All right, so I'll stop there because I was getting a little wound up. Thank you for that question.
Do you want to add more to that, Carter? I think you have a lot of experience with your advocacy, if I can put you on the spot.
Yeah, around the Equality Act, I don't have a whole lot more to add as far as, For the Equality Act, Tori laid it out very well as far as what it does and who it protects, a federal protection that gives equity to everyone. And in my experience, I became a strong advocate for the Equality Act, again, just due to my own personal experiences. And if I can just share just a little bit, very briefly. So I mentioned that I started my transition, or I transitioned from female to male well over 20 years ago when the landscape was very different. There was no visibility of trans people. The only place I saw a trans person was like Maury Povich or Jerry Springer, and it was, this whole oddity and phenomena. Oh my God, look at the picture of the beautiful model before, and now look at the man, and that sort of thing. So the protocol when you transition then was to live stealth, as they say, or non-disclosed. Depending on your ability and your access, if you could, you would change your name, move to another city, get another job, start all over and forget about the past, never bring it up again. I attempted to do that. And I was successful for quite a while. I was working in corporate America well over 12 years. And once I transitioned, I moved to another company, moved to another city, had my name changed, and I began operating as full male in that position. It was incredible. I was no longer, the person that looks like a man, or the gay girl that looks like a guy, or, wondering why didn't I get that promotion? I did more than they did. All of a sudden, it felt like the doors were open up. I was, when I said something, it received more respect, a little more credibility as a man than operating as a female. I received like 3 promotions in 2 years. I was a top producer. All of my colleagues loved me. And then one day I come into work and a couple of my colleagues pulled me aside, want to speak with me privately and let me know. And when they pulled me, felt very taken off guard because their energy and demeanor was very serious. And they pulled me aside in a private room and they said, there's rumors that you're a woman and we want to know if it's true. And so, of course, I felt totally ambushed. I was embarrassed. I was hurt. I was angry. I didn't know what to say. Again, I was living my life just day to day, going to work like everyone else, raising my family like everyone else. And I didn't think I was doing anything wrong. But when they came to me, I felt like, oh no, I've done something wrong. And in that moment, I had to decide if I was going to actually confirm or deny who I really was, because I hadn't confronted that as a trans person. I transitioned to acclimate to what society was. And so long story short, nonetheless, I continued to work there, and the harassment was so prevalent after that day that it became depressing just to pull up at work and get out of the car and go into the job, because who's gonna look at me funny in the break room today? Oh, so-and-so stopped talking to me yesterday. Wonder why the guys don't invite me to lunch anymore. Everything changed by this little piece of information. I was still operating the same, but everybody else changed, or so it felt for me. That really did send me into a big spin of depression. It broke my confidence. I didn't feel that I was a great employee anymore because no matter what I do, if I'm transgender, nobody's gonna value my work, is how I felt. I felt bad because I was the provider for my household. We had a new baby. And now all of a sudden, not only am I out of work, but my mental state is crashed and I can't be strong enough for my family, or so I felt. And this was at the point, a pivotal moment for me, and I'm sorry, I'll wrap it up really quick. This was a pivotal moment for me because that's when I was compelled to find community. I really needed someone else to share their experience. I could no longer be stealth and living on my own little island. I needed community. I needed someone who had walked the journey to walk with me or show me the way or give me some sort of support. And so that's when I began to reach out to find my community, and I found that on social media. And from there, just hearing other people's stories of their discrimination in employment, being ostracized from their homes, losing their house that they're already in because someone finds out, all of these things were detrimental to the well-being of people like me. And so I had to speak up for people like me. And, I became a part of the Equality Act because employment discrimination was what propelled me to this whole thing. And I was dedicated to making sure that anyone who wanted to work and provide a living for themselves and their family have that right, because I understood the impact that it has on anyone and their family, on an individual and their family, to not have the opportunity just to work, to not have the opportunity just to go to the bathroom while you're at work. All of these things can simply be changed and society fully opened up for everyone in it by passing the Equality Act. And so that's why I'm a stern advocate for the Equality Act, because it provides federal protections, not just within states, because there were no ramifications to me being fired later on. I live in Texas, it's an at-will state. They can fire you on your lunch break and don't have to tell you anything or why. So no one said because you're trans, you're fired. They just said we're downsizing and you're out of here. And I was the only one I guess they just needed to downsize by one person. So again, the Equality Act will make sure that this is no one else's narrative on down the line, and that everyone really does have full access and equal opportunity and federal protections to live the life that they deserve.
Thank you.
No, okay.
I did have a
Oh, okay.
question. It was about disinformation. And I worry that so many people are getting disinformation and know nothing about the topic at hand. So with sports, I'm always hearing people talk about sports. My sister's an athletic director for the city of Philadelphia. She sits on like athletic boards and actually knows like what goes into deciding different things about sports. So why would I try to tell her what she should be doing? With medical care, people are talking about what should happen, what shouldn't happen. You're not hearing physicians. So I sort of feel that breaking through the disinformation, it would be helpful to hear more from people with the actual expertise to speak on the issues. We're hearing from Candace Owens and Ron DeSantis and their minions constantly. So I just am not seeing people with expertise. And yes, there's AAP, but there's, AAP has this long statement. Nobody's going to read that. They're not on TikTok. They're not doing sound bites. So any advice about breaking through this disinformation chamber?
So I will add that you all as researchers have much more power perhaps than you realize when it comes to that. And I believe I heard the dean, I wrote this down, I thought it was brilliant. Science for evidence and evidence for respect. Is that what you said? Something like that. Well, I like both statements, mine and yours. But use the power of truth to fight for you. So the truth is trans people have always played sports. It just became an issue during the last administration. Trans people have always, from the beginning of time, trans people have always used the bathroom. There is never a time in recorded history that trans people didn't use the bathroom, but it became an issue during the last administration. That's the truth. And so as researchers, as academics, you all have to use the tools that you have, and that is research, that is research studies, that is history, that is historical context, that is all kinds of different things to ensure that people get as much information. I personally don't believe that any of us has the power to change people's minds, because if so, they could convince me that their foolishness is correct. But what I believe that we all have the power to do is to provide as much education so that people can make the most informed and healthy decisions for themselves. Disinformation takes away their ability to make informed decisions. And so our job, our charge, our call is to sit in front of you and provide information for folks who know a lot of stuff, but then for you all to go back and educate people in your communities and in your work as well. So you tell your sister what's right.
Well, I mean, she knows. She actually sets guidelines and rules. I wish more people were listening to her about
Should have
sports.
invited her today.
So I think that's a powerful point to end on. And an excellent point about really thinking about how we're advancing health and human rights within the context of all of our work. Please join us for lunch today. So we are in W4030. It's a different room. Please make sure you go to the right space. And feel free to network, meet our guest speakers. They're wonderful people. They're excellent friends. And I'm so happy they were able to join us today. Thank you.
Thank you so much.
Thank you.